Okay, so I'm going to do my procedure now, I guess you could call it. I kind of had a hard time thinking of what would be something good and time-wise something to demonstrate in class, simply because since we are such, my field, at least in my studies, is so much on the social, cultural, behavioral side of things that we don't have many as unique procedures or necessary techniques as a lot of people do. Maybe if you move over to the environmental health side of things, or people who work in disease planning, disaster readiness kind of stuff, they have more, you could say interesting for some people, but unique kind of procedures and outlines and things that they actually do. But one of the things that I did think would be kind of interesting to share is the way we kind of conceptualize health, how we look at it, and why we develop interventions the way we do, using the model that we do. And that model is the socio-ecological model. And it's basically a 5-level holistic model for understanding any kind of health issue. Even if the words don't necessarily line up with the boxes you're filling in, you kind of have to fill in the context for itself. But more clearly defined by the Institute of Medicine, it's a model of health that emphasizes the linkages and relationships among multiple factors affecting health. So we do inherently recognize that everything in health is interconnected. Actually, health can extend to almost every part of your life. Everything plays off each other, and that's what creates the health situations that we have to figure out how we can address as holistically as we can. And the model looks something like this. So you have the 5 levels. You've got intrapersonal, interpersonal, organization, community, and policy level. There are a couple different versions of this. Some have it in a circular format where you've got the interpersonal on the bottom and it works its way up. Others do a block chart like this, but they all follow this basic structure. Sometimes this is just called the individual level. And it's really easy to get these two confused because intra and inter, people think that tends to mean the same thing, but if you take this as the individual level, what this means is that it's your relationships between and among groups of people or peers. And each level has different kind of areas that you look at. So the first level has your knowledge, attitudes, values, beliefs, skills, kind of those inherent individual components of health. If you move a next level up, you're talking about your social networks, your family, your social groups, support networks, your norms, kind of more culturally or socially ingrained things into you. And then community and organization kind of get confused too a little bit, but they do flow into each other, so there's quite a bit of overlap. Organization means more of what are the institutions around in your area, like schools, for instance, are a really good institution to consider if you're doing an intervention for children specifically. But it could also be a workplace environment, and it could also just be a number of other support networks that are there for you. And then you go onto the community scale, because usually you define your work as looking into a specific community or specific population. So those are literally could be community resources such as a neighborhood organizations. You're talking about the health and social services that are available to you, anything that's within a community or just a community system in general. And then we go all the way to the policy level, which is literally going from your local policy in a local town setting to the federal level where you try to influence health policy overall. And honestly, using this model, you can hit all of these. It depends on your scope. It depends on also the amount of resources you have at one time. But most public health interventions do focus on the inter and interpersonal, sometimes the community level, simply because usually confined by resources or the grant that's funding you has very specific stipulations of what you need to focus on, and the easiest things we can focus on without a lot of resources are behaviors, which is where most people start. So I kind of want to give an example of this that might help make that a little clearer, and that is, let's just take obesity and put it in the framework. So what are some interpersonal kind of considerations we have for obesity? And these are the inherent things. Genetics is always a big one because genetics plays a role into your predisposition to any health concern. It could also be your knowledge, attitudes, belief about what it means to be obese or not, or overweight. That varies a bunch of different populations, and you have to be sensitive to that. It could also just be having or knowing the concern of what that means for people. And it also could just be your income level. But you could put income in a couple different categories depending on how you conceptualize where that falls. In the interpersonal level, it's kind of like I was talking about. It's your family relations, your social norms, what reinforces those ideas that, what is obesity, what is it to you, and how do you perceive it? Are there, is there support for diet and exercise? Is there support for it? That doesn't matter. you know, what kind of reinforces those individual values. On an organizational level, you could think about it in another school setting. There's always big issues like, well, what, do you have a choice to eat anything at school? Are they still serving hot lunches? Do they get enough funding to provide healthy options? Do they have a salad bar at work or something like that? So it could also be access to gyms. And you could also look at recreation club sports. On the community level, it's very similar to the interpersonal level, but you're scaling it up. What are the community's values and norms? If you're living in a town, does that have a particular vibe that promotes something? Like you could say Athens probably promotes a particularly healthy lifestyle because of the vibe of the people and the culture here. And then on the policy level, it could go into things like what are the food regulations that define like what gets sold in your supermarket, what gets shipped to you, how far does it get shipped to, like when they tried to pass the law, I don't know if this passed, it may have, when they tried to limit the size of sodas in New York, I believe. And that is kind of, you know, how you can look at it in that level. And that's one example, but I think, because this is important, because a lot of the disciplines in here focus right on the individual level, the immediate treatment right there. And we have to kind of look at it from the 55,000 view, and we want to see what we can change and influence as a total. So if I did my math right, I need 5 groups of 3 people each. So 1, 2, 3, 1, 2, 3, 1, 2, 3, 3.
We have the nursing students.
Okay, we'll do for like 5 groups either way. Because what I want you guys to do now is kind of like these are rough examples that I'm pulling up, but these can obviously be expanded on, and these help determine the what and how we're going to focus on things in interventions. So I have 5 different groups and 5 different health topics to look at. So you could do teen pregnancy, you could do diabetes, lung cancer, depression, and illicit drug use. 1, 2, 3, 4. Well, I guess that's only. Yep, that's only 4, isn't it?
It's 5.
No, it's 5. Okay, I can't count. So, you know, each of you will get one of these little charts. I know there's a 3rd row on the. Oh, I'm just dropping everything. There's a 3rd row on the other side of that model, but it's incorporating theory, which is a little bit too much to try to explain and go into right now, because then you're looking at individual behavioral models, group behavioral models, and that also will then be used as another framework to guide your intervention. But the really important part of this is how can you break down health into all those different factors that affect each other, and where do you decide to place things, because admittedly things can go in different places. So I'm going to pass these out, and then
Stephen,
yes.
real quickly, most people are sitting in their disciplines. Do you want them to be mixed up, or do you care if it's
Yeah,
all
let's
the
mix
social
it up
workers?
actually. We'll
Okay.
do like 1, 2, 3 count off kind of thing.
There we go.
So 1, 2, 3, 4, 5. Roll. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3. So we'll do 1s, 2s, 3s, 4s, 5s. That works.
Max,
Throwing you
you're a 1.
I was a 5.